Welcome everyone to the Who to Contact with Your Medicare Questions webinar. My name is Tom Ryan with Provider Outreach and Education, and I'll be your presenter today. Today, I'm joined by Aline Sigler from my team, and she's also my friend. What she's going to do is help me with that chat. She's going to monitor questions, anything you put into the chat, to kind of help you guys through that. This webinar is designed for those who are wishing to learn more about Medicare and which entities handle which types of inquiries within the Medicare program. We have received and done a variety of different new to Medicare type informational sessions. And as we've done those, the questions have become clear that there aren't always understandings of who contacts, which inquiries go to which contractor, which inquiries go to certain federal portions of the federal government. How do we handle all of that? So that's really what we're looking at here today. I want to remind you that I did just mention this is going to be some high level information, claim specific information. We'll talk about that in a little while as to where those claim specific questions go. This is not something we can take and say, hey, here's my claim number and I can look that up during this webinar. Not it. We're going to talk about the appropriate entity for that. Before we do that, let's get started with a little bit of housekeeping. The presentation for this webinar is available in our training center on our live events page. The slide does actually say training center, and there's a reason for that, but I'm going to ask Aline to put the live events direct page in the chat. Go ahead and grab it and download while I talk. A couple of things. The training center does contain our training material. The live events page is where you'll find information for current upcoming events. In other words, events that are usually within the next 5 days. Otherwise, we won't have it posted yet. Once an event is complete, so either later that day or the next morning, the material is then removed. We do record it and we will post it in the Encore presentation area. When it's posted to the Encore presentation area, you have 60 to 90 days to download the material from there again. Now, we do say 60 to 90 because we do host a lot of events and we try not to keep that page getting too long. The recording itself will remain available in YouTube for as long as the information is accurate and relevant. During this live event, if you have a question, please send it into the comments field in the chat. What I'd love is to take as many questions as I can, build them up. We'll go ahead and get those answered. So if I don't answer something, go ahead and ask those. I do want to address as many or all of the pre-submitted questions as I can. So keep in mind, I will bring those up as I go through and say, you asked or you did this during registration. Meaning one of you guys is a registrant, as someone that's attending, wanted some pieces of information, and we definitely want to give that to you. One last final thing about housekeeping. After this event, we're going to give you a survey. We're going to give you multiple ways to complete that survey. It's important because it's not just about me as the presenter and this event. It grades WPS as an overall, grades the event, it grades a bunch of different pieces of this event, but it also gives you one very important opportunity, and that is to let us know what you want to hear in the future, what education we can do. So please, please take time to do that survey. Of course, I'm going to give you a brief disclaimer. Whoops, went too far, sorry. A brief disclaimer. I did check this information. It was current. I did have to check some websites within it, wanted to make sure everything was good. But as you guys know, Medicare rules, regulations do change often. So as a provider representative who's getting paid by Medicare, you are responsible, or that provider is then responsible for keeping up with current rules, laws, and regulations. They are available on the CMS website. The material today is a tool to assist the provider community. Anything that changes, of course, will always be the most current information, and you do want to keep up with that. We'll do the best we can to answer any questions that we either pre-submitted or given live. But keep in mind, I may say if you have further information, you need further information, something, enter that into the chat because sometimes the questions don't give us everything we need. Again, if you are recording this presentation, we do ask that you stop. That does include screenshots or any other type of recording. We are recording it. We will post the education pending the quality of the education on our YouTube channel and then link to it on our website in the Encore presentations page. All right, so what are we going to talk about today? Because this is the goal and what you're here for. We want to help you determine when to contact different Medicare entities, but also contractors, and then the departments within WPS. So really, we're going to focus on some of the bigger entities in first, and then we're going to talk about, hey, when you contact WPS and who we are, and then we'll give you some different resources and items like that. Our goal is to help you get your questions answered the first time without having to go through a variety of different contacts and information to get what you really need. So let's see what we can do to help you there. The first one actually is put in there to answer some questions. Now I'm going to consolidate all the questions into one, but the basic question that we got was, who do I contact with which type of questions? Where do they go and why is that important? Well, if you aren't contacting the right entity, you may feel like you're getting the runaround. Medicare is composed of a lot of different entities, not just contractors, but the federal entities themselves. And so each portion requires a certain contact, which means they do a certain function within Medicare. And that's why you may feel like you're getting a runaround when really it's just getting to the right person in the right place. One of the first questions we actually received, which I do want to address, is when do I contact CMS versus the Medicare Administrative Contractor? And I'm going to talk about the Medicare Administrative Contractor, or MAC, on the next slide. But let's start with, when do you want to contact CMS? First of all, CMS is the oversight entity. So we are under the Department of Health and Human Services. The job of CMS is to make sure that the operations of Medicare are complete, such as hiring contractors and oversight of that portion of those contractors. This does not mean the federal oversight goes away. Instead, that is done through a different office, and that's central office. So many people ask us about central versus regional office when it comes to CMS. By the way, this was two of the questions that were submitted, so let's talk about that. So while I did say CMS in general has oversight, central office has national oversight, things that affect everyone across the nation. So they would do things such as national coverage determinations, basic Medicare principles, policies, and procedures, such as the internet-only manuals. That's their job. They would also look at things like the Medicare Learning Network and making sure all of that information is current. So really, that's what central office is tasked with. You can contact them if you have questions. In some cases, you'll actually start with the lower level, which is the regional office, and we'll talk about those in just a moment. And they may refer you to central office because your question is on a broader spectrum. Okay? However, there are regional offices, and I will show you where to locate these contacts in just a little while. So bear with me. When we get to the end of it, we'll go through all those website things. I want to get to the slides first. Regional offices are the offices that control the individual contracts. So in other words, they control who processes Parts A and B claims. They control the different Medicare Advantage plan contracts, the prescription drug plan contracts, and other types of contracts like that. When you're not sure, please start with your regional office. They'll help you move up through the central office. But I want you guys to highlight MA plan right here. They, at the regional offices, are the ones that if you disagree, you don't think something is going properly, this is who you're going to contact. Okay. So where are the regional offices located? The answer to that question is across the United States. There's one in Atlanta, one in Boston, one in Chicago. Now the Chicago regional office does in part control WPS. We have Indiana and Michigan under Chicago. Then you have Dallas, Denver, Kansas City regional office. Now that one has Iowa, Kansas, Missouri, and Nebraska. Now that is our J5 contract. Then you have New York, Philadelphia, San Francisco, and Seattle. Keep in mind, just because you're in one of those states, if it's an MA plan, you may need to go to one of the other states. And I'm going to show you a tool that will help you identify which regional office controls which Medicare Advantage or MA plan, Part C plan. So when you're talking about Medicare, CMS, please make sure that you go to the appropriate entity for that, and that's a regional office for the basic federal oversight, the kind of centralized information, the national information. Then go to the regional offices for things specific to certain areas of the country and the contracts within those. Along with that, the contrasting question was, when do you contract the Medicare Administrative Contractor? No, let me be as specific as I can with this. Medicare administrative contractors' primary functions are claims processing and the related functions. Therefore, they work for traditional fee-for-service Medicare under Part A and B. There are a variety of other types of contractors that go into it. On this slide, you will see the AB MAC jurisdiction. There are separate contractors for durable medical equipment, railroad Medicare. Also, some of the AB contracts contain a separate component called home health and hospice, or HH&H. So when you're looking at which contractor, which Medicare administrative contractor you need to contact, it is the one that processed your claim or will process the claim for that jurisdiction or that type of Medicare. Remember, railroad Medicare could be in any of the United States in its territories, railroad Medicare, but it has one specific contractor, Palmetto GBA, that handles all processing for that. So if a patient is Medicare eligible due to that, that's what we're looking for. Okay. There are otherwise, again, DME is separate. Home health and hospice is part of the AB MACs, but the jurisdictions are divided differently. Otherwise, there are 12 AB MAC jurisdictions, and this is what the map shows for you today. So what is considered claims processing and related functions? Well, start with your provider benefit inquiries. Provider, highlight provider, circle provider, whatever you want to do. Do not refer a Medicare patient to us. As a Medicare administrative contractor, we can't help them. We have to refer them to 1-800-Medicare. So if a patient comes to you and has Medicare questions, refer them to 1-800-Medicare or the individual MA plan. As traditional fee-for-service Medicare, though, you would look at claims issues or concerns. What's going on with my claim? What's going on with the concern that I have about a policy? Something like that. Now, policies would be local coverage determinations. Remember, national coverage determinations were handled by central office, local by your Medicare administrative office, Medicare administrative contractors. We do also do provider enrollment. It's part of the claims processing. If you aren't enrolled and we can't guarantee that you're supposed to get paid, you're not going to get paid. So that's all part of claims processing. Also, as part of claims processing, we look at or review the original determination. It's called level 1 appeals or redetermination. There's also something called a clerical error reopening function, and we do that, and that's just for minor errors, omissions, things like that. So that is all considered part of the basic claims operating process for Medicare. But remember, as a Medicare administrative contractor, yes, we process claims, and yes, we answer questions, but only for the provider community. 1-800-Medicare does the patient's Medicare, and we'll talk more about that in a little while. The next area that I was very specifically asked a lot about are those Part C plans, or Medicare Advantage plans. And where do you get help and where do you get coverage? First of all, as I said, regional offices do a lot of information regarding this, but the basic plan information such as policy, coverage, billing questions, payment questions, recoupment questions, that's all done by the individual Medicare Advantage plan. So you have to contact them or start with them. If you haven't contacted them and you go straight to the CMS regional office, then you're going to wind up in an even bigger or messier control entity, because they'll go back and they'll say, go back to the MA plan, get some basics there. Now, it's not to say they won't help you, but they really do want to hear when you have plan issues or concerns. This Medicare Advantage plan isn't doing this. This Medicare Advantage plan isn't following this portion of the Medicare regulations. That is when the regional office with control over the Part C plan gets involved. Now, I know that sounds like, oh, Tom's making it sound super simple. Keep in mind, I'm not involved in this process. We work for a traditional fee-for-service Medicare administrative contractor. I'm giving you a message that's given to us, but we can't help you with anything to do with an MA plan. I'll give you what I can, and that would be to show you where to find a list eventually. It's a little bit later on in the program, but I will show you where to find a list of the MA plan directories. So you do need to go back to the MA plan. Next question we were asked is, when do I contact someone, or how do I contact someone regarding Medicare secondary payer issues? This question is a bigger, broader spectrum, so I'm going to put a couple other caveat questions that also went with it. First, can I contact the Benefit Coordination and Recovery Center? The answer is yes, but in limited circumstances. You are represented to the provider community. The Benefit Coordination and Recovery Center, their job is to update the common working file. In other words, update the record that controls whether Medicare pays primary or not. So we are the claims processor, but we do not control this record. It is controlled by the Benefit Coordination and Recovery Center. So in order to get this record updated, you should always start with your patient. It's the patient's record. They own it. It's their responsibility to update it. Now, before y'all start throwing things through the computer at me, we do understand that doesn't always happen, and which is why we built a little bit more on this slide, okay? So when it comes to Medicare secondary payer, which is other insurance that pays before Medicare, if you're looking for contact information for this, first, determine if it's a claims-related question, such as how did this claim process? Why did we deny it? Why didn't we make an additional payment? Those are your Medicare administrative contractors. If it's something like, hey, you don't have this insurance on file, this insurance is end dated, anything like that, that's the Benefit Coordination and Recovery Center. Now, I want to make a little note here. As a representative of the provider, in order to get a record updated, primary payer record updated, you must have information on that primary payer's letterhead or otherwise identifiable information, and that must then be given to the Benefit Coordination and Recovery Center, or BCRC. That's the only way you can do that in writing. Again, they're responsible for getting those records up to date. They do work with other people, other entities, such as lawyers, legal stuff, to get repayments done. But you do not do that. You work with your Medicare administrative contractor. That's part of our job. It's an overpayment or a claims-related function. Now, they do it for different entities, legal entities, anything like that. So there's a variety of different things they'll do. Now, the MA plan also has a component of Medicare secondary payer. If for some reason it is their claim, then it is their plan, and we can't really even help you through the process with that one. You got to go to the MA plan. So I would recommend contacting, again, that MA plan. So Medicare secondary payer is not just as easy as, hey, always contact. It's who's contacting, what are they contacting, and why are they contacting? Question came in regarding this. They wanted to call the Benefit Coordination and Recovery Center while the patient was with them and then get the patient to update the record. That's perfectly fine. The patient can actually, on the phone with you on a one-time basis, authorize them to talk to you for that entire call. That's fine. And as long as that's the case, they'll work with you on that. But otherwise, no, you can't just call in. Of course, Medicare has a caveat for that with the BCRC, and they say if the patient's deceased, one time, one provider can make the call to get that record updated. So just a lot of information to give you on MSP. I think I covered all of the different questions, but if I did miss yours, please put that back into the chat and we'll get that one answered. I did receive some questions on appeals questions because there are 5 different levels of Medicare appeals, and it's when do I contact each level, or when can I move from one to the next? I'll give you a couple of examples, and one in particular they asked for. So let's start with some basics. Medicare appeals is divided into 5 different types of appeal. The first level of appeal, or I should say levels, the first level of appeal is a redetermination done by the MAC, the Medicare Administrative Contractor, who processed the claim. That is level 1. The second level of appeal is a reconsideration performed by the Qualified Independent Contractor, or QIC. This is the second level, and it is an independent contractor review. The third level of appeal is performed by the Office of Medicare Hearings and Appeals under the Centers for Medicare and Medicaid Services. This is either performed by an administrative law judge or an attorney adjudicator. The next level is the Medicare Appeals Council, which is performed by the Department of Health and Human Services Appeals Board, DHHS Appeals Board. The last level of an appeal is a federal district court review, and this is in the federal district court system through one of the different district courts. So again, that one we don't have a lot of time frames on, but that is available to you. So one of the questions we got is, what happens if someone doesn't process timely the redetermination? So that means that the Medicare administrative contractor did not complete this within 90 days. 90 days. My answer to you is, okay, then you're going to move to a reconsideration level. You're going to file to the qualified independent contractor, and what you're asking them to do is to let them know that it wasn't completed timely. They'll look at it, they'll make sure that it should have been completed timely, that you do have the right to have it completed, and they'll remand it back to the MEC and say, hey, get this done. That still counts as a redetermination though, because the original was not performed. Instead, it was a missed timely filing, but we do have different timeframes for those. So hopefully that answers your question. That does go for each level until you hit a federal district court. They're not going to remand back for that. They're going to actually review it. Another question that came in regarding them is, when you contact, can you contact each of these different agencies depending on the status of what they have pending with them? I'm assuming that means that you filed an appeal and maybe you have it at the Office of Medicare Hearings and Appeals. Can you contact them? There is a website that has their information on it. It is available on the CMS website, and I'll show you that in a little while. We ourselves, we don't have like a way for you to go onto our website and check that level. We don't do that. That's not something that comes to us. So we don't actually have that. Now, a redetermination, you would be able to go on our website and check the redetermination level to see if that has been completed, what the status is, all of those different things. So I'm not really sure exactly what you were asking me with that question. The last one that I had for this is, who at WPS handles appeals inquiry questions? My response to that is, at WPS, it is our customer service department, and you would contact them with your basic questions. If they needed to move it around, they would refer it around, which could mean simply moving it up to a level 2 or level 3, a customer service specialist. It's really just dependent upon what the question is and whether or not they're able to answer it. So hopefully I hit all of those different questions within that. Again, if I did not, let's go ahead and put that back in chat. The next set of questions we got is, of course, regarding medical review. And this also then, the question itself relates back to the appeals slide as well. So we'll talk a little bit about the medical review entities and how do you question them. And then we'll talk a little bit about what happens if you disagree with them. So the first opportunity you have to do medical reviews with a Medicare administrative contractor. They do pre and post payment medical review. That's us. We can do pre, we can do post, we can do prior authorization reviews, all of those types of things. Those are our type of medical reviews. The next one is the recovery audit contractor. They do targeted medical review on a post-payment basis. Their basic job is to look at claims that are processed and to see if we process them correctly. They do have to go to CMS for approval before they can start looking at any claim type, which is why it's a targeted. Then we have the supplemental medical review contractor. This is the one that the person specifically asked me about, and they had never heard of it, and they got a letter from them. The supplemental medical review contractor, if you want to think of it easily, think of it as a special projects person for CMS. They do what they are assigned to do. They can look into different benefits programs. They can look into changes to the program. They may review a variety of claims to see whether or not this would be an effective change. They may look at coverage criteria. There's no like specific item or service, anything like that. Now, it would be specific if CMS tells them that's what they're looking at. Sometimes they do things for demonstration programs and demonstration processes within Medicare. So really think of them as they're specialized. Keep in mind, if you're doing a post-payment review and it is with the SMRC and they do ask you for the information, you have to respond. You have to. If you don't respond, it's just like not responding to us when we ask you for medical records. You will have your money taken back. Another person asks, what is the difference between the RAC and the comprehensive error rate testing or CERT contractor? I know you didn't use the full names on either one of them, but let me just explain. The CERT contractor is actually a medical review contractor that is looking for the national paid claims error rate. So their job is to look at paid claims. They then target at random a sample of claims that is statistically valid. No, I cannot tell you what a statistically valid sample is. I'm not a statistician and I'm not that good with numbers. However, they have a statistician who decides that, whatever that is. Then they look at those, they pull those claims. Again, it's not something that they pull across the nation equally. It's not anything like that. It's all processed claims from across the nation. They assign whether or not it was processed correctly. If it wasn't, they assign an error category, and then they make reports based on that. So they have a whole contractor who does data analysis different than the medical review contractor. So just so everyone's kind of aware of where that is. So remember, when you're talking the RAC, you're talking targeted reviews. When you're talking CERT, you're not talking targeted. They're not targeted at all. It's kind of a random sample. Some people have latched onto that. It's a stratified random sample. Stratified just means that they may look at certain types of things more, or may put weighting into the sampling system so that they get more of a service that is billed more frequently and less of a service that is not billed as frequently. That's all stratified means. It doesn't mean that suddenly I'm going to target you as an individual provider. And that was one question that came in. They said we've received a large volume of CERT requests, and they're feeling like they're targeted. It's not possible for CERT to do that. That's not their job. I will tell you, this particular provider by name, when I looked them up, is the largest provider within their state and the second largest provider within our jurisdiction for that jurisdiction. The reason you seem to be receiving a lot of them, if you think about a stratified random sample or a random sample at all, if you're providing more services than anyone else, or the second largest provider of services than anyone else, who's more likely to get sampled? That's where that came from. So hopefully that answers your question with that. The last one that we put in there in particular was due to a question. They had an Office of Inspector General request, and they were very surprised by this. An Office of Inspector General request does not mean that you are being targeted for fraud and abuse. What they're actually doing is looking at the Medicare program and potential vulnerabilities within the Medicare program. So if you've done nothing wrong and you followed all the guidelines, great. That's what they're going to find. It doesn't mean that they're looking at you in particular. What they're doing is looking at certain services. They actually do publish a work plan, and you can take a look at that. So there's a variety of different things you can do to get through any of those. I just wanted you to be aware of that. One of the reasons it says others on there, there are other entities that do medical review for a variety of different reasons. If you would like to learn more about those, I do recommend that you attend our New to Medicare medical review class coming up. One of our clinicians who actually works with medical review on a regular basis will teach that, not me. So join Mary Sue's class, listen to what she's got to say on medical review, and learn more about all those different contractors versus me targeting the questions that you asked. The one question that I did want to bring up, the reason that I bring this up is ties to that previous slide when we talked about this. What do you do if you disagree with a RAC or CERT decision? And the answer is you appeal it just like you would any other medical review decision. Now, you do not necessarily appeal the decision. What you would do is wait for the overpayment from your Medicare administrative contractor, and you do an appeal of the overpayment stating that you disagree with it and why you disagree with that decision. So you are not appealing the original claim decision. The original claim decision is not what's an appeal at all. It's the medical review decision which created the overpayment, and the overpayment is what you disagree with. So hopefully that answers that question in a manner that helps you. Which, of course, will bring us to the first set of question and answers. What I'd like for you guys to do is to add any questions that you have to the chat. In the meantime, I do have one pre-submitted question I'll go over, and then we'll take a look at it. Now, this pre-submitted question is going to lead me out to the CMS website, because this is where I do want to talk about this. The pre-submitted question that I'm using here is, who do I contact with Medicare Advantage program problems? Okay, let's start off here. First, I want you to go to the CMS website. Remember, I said contact the program, or if you're not feeling like you're getting what you need from them, you can contact a regional office with control. In order to do that, you need to come up here and go to Data and Research. Scroll down, okay, and you're going to go Data, Research, and Topics, Statistics, Trends, and Reports. And I think this is why some people get confused by this, but this is what you're looking for: Statistic, Trends, and Reports. When I do that, Medicare Advantage Part D contract and enrollment data, this is what we're looking for over here, okay? Now, if I scroll down, and I'm going to scroll down, and I want you to watch this left side of my screen because it's a big old long list. I'm just going to scroll down, and I'm going to scroll down and down and down and down, and suddenly I'm going to pop up with an MA plan directory. This is what you're looking for. So for this, you would want to open this up. And again, you're just going to go ahead and open up a zipped file. The zip file will come up, and it's going to say, okay, what do you want me to do? Well, I want to open the zip file. Don't know why I'm replacing that file, but okay. And then by doing that, oh, that's why, because I had already downloaded the file. I apologize. I'd already downloaded the file, and I'm just replacing it, which I didn't necessarily need to do. You can open the file up, and it will allow you to view an Excel spreadsheet. What's great about the Excel spreadsheet is that during this MA plan directory, and if you use the Excel or the comma one, it will tell you what the plan's legal name is, what the doing business as name is, which is typically what you will know them are. It's going to tell you which regional office has control. And so that's important to know, because then you have to know, hey, who do I contact? So again, here's your legal name, marketing name, all of these different things. Here's your contract number. Okay. If we scroll over though, we see a bunch of different pieces of information. And then it says, let's see. Oh, I'm missing the column here, sorry. Oh, because I went the wrong way. Type of organization, and it should say regional office. CMS regional office responsible, which is column I. So this one would be San Francisco, this one is Chicago. What you do is you find this information out, then you go ahead and exit out of these, come back to this website, go about CMS, then you're going to go contacts, scroll down under contacts, contact database or contact, whichever one you want to use, either one will work. And then you can find out all the different information that you need. If you scroll down, it will say your regional office contacts, and then you can look through the different regional offices that you need. So if you found the one in Chicago, that would help you. Or you can simply scroll down to the bottom and find a list of them and a variety of different things that you may need. Okay. So hopefully that helps you and gets you a little bit more information about where to go to with those different plans and how to get the different pieces of information that you need. All right, Aline, do we have any questions in the chat?
Thanks, Tom. We did get one question from Maddie, and she asked if there was a phone number for the Benefits Coordination and Recovery Center. And so I did drop a link in the chat a while ago about that, that contact page. So what I did, since you're out here on the CMS website, is I put BCRC in the search, and I just brought up that contact page. So that's why everybody saw that response from me in the chat.
Perfect, thank you. So if you guys need more on that, let us know. Go ahead.
I'm sorry.
Oh no, go ahead, Aline.
That was
any more?
That's the only question received so far.
All right, so I don't have anything else and any other questions that we have submitted, so let's keep going here. The next section, I call it when, and it's when to contact WPS and who to contact at WPS. So this is going to answer some of the questions that we received regarding that, and because we did have a large volume of questions. So first, customer service is our primary contact. Okay, again, 1-800-Medicare is for patients. WPS call center is our customer service call lines. That is the provider contact center. It's their primary source. So when we look at these two different things, what does WPS call center or customer service do? They answer anything related to benefits inquiries, claims information, general information. Now, we put general inquiries such as MSP questions, basic general information, yes. Updating MSP records, no, we can't do that. Just like they can give you provider enrollment status and answer some general provider enrollment questions, but when it comes to an individual application, what's going on with that application, they can look it up, they can give you some different information, but on occasion, our provider enrollment department is going to contact you and you need to contact them back. And we'll talk about that next. Also, they can answer general LCD and policy questions. So whether it's a local coverage determination, whether it's a local coverage article or a national coverage determination, how that is being implemented within our system, that's what they answer. If you want changes, that's a different mechanism entirely, and we're going to talk about that. So provider enrollment. One of the questions is, how do I get a specific representative in provider enrollment? And look, that isn't something that can happen. What happens is the only way to get that person is when they contact you, then you can contact them back regarding your application. Otherwise, it is general inquiries. Another question we got regarding provider enrollment, and there's actually two different things on here for this purpose. Aline put a link in there, and it is about contacting for enrollment application status. An enrollment application status is something that we cannot give out from customer service, nor can provider enrollment. On the other hand, we do have tools available, and they are self-service tools. CMS and the provider, beneficiary and provider communications manual tells us that we are not able to answer anything that a self-service tool can do. That's what Aline actually put in there. She gave you the section, she gave you the link to it, she gave you all the information for it. Check it out. So the question that was asked was, how do you find out your enrollment application status? One, check out EASI, the electronic application status inquiry. This will do both paper and electronic applications, and you can find out the status. The Provider Enrollment Chain and Ownership System, or PECOS, does electronically submitted applications. It is a great tool. It will actually give you more information than EASI is capable of because it's the direct system. But it's the electronic system, it's not the paper system. So if you submitted it electronically, great, you can get your status there. You can't for paper. That's why I tried to give you the reference to say, hey, a CSR can't do this for you. It's not because they're trying to avoid it. It's that it is prohibited by CMS. Here are your two resources for that. And then the other portion of this that again came in was, when do we contact or how do I contact my direct provider enrollment representative? Nobody has a direct provider enrollment representative that works with them exclusively. What we do is have provider enrollment representatives take on the application on a first come, first served basis. You will only contact them should they contact you, and in that case, they will give you contact information. If you do not have an application pending with that person, they will not be able to help you. So hopefully that answers all of the questions regarding provider enrollment and the application, why you have to look things up electronically. That one again becomes a much bigger question than just provider enrollment, but it was posed as part of provider enrollment. Okay, policy. We have a lot of confusion. I was very surprised over this one myself. So one of the first questions was, who do I contact regarding a policy? This is a very general question, and there's a lot of information that goes with it. So I'm going to answer that question, but I'm also going to answer a variety of other questions, and hopefully I don't miss anything. So let's just start with national coverage determinations. If you are looking for an explanation of how we process a claim on a national coverage determination, or how we're looking at that, that's us at WPS. If you are looking for the rationale behind a national coverage determination, why it was put in place, any of that, that is the Medicare coverage database available on the CMS website. All of that information is contained within there. If you are looking to have a national coverage determination reviewed by CMS, this is something that has to be done through a request to CMS in writing. Okay, we don't actually get to do this one. This isn't something that has anything to do with us. On the other hand, there are local coverage determinations, which we will include local coverage articles in as well. Those are both things that we write. One is an actual policy, and one is a coding and billing article that explains what the system does under that policy. Okay. So basically, for general explanations of any of this information, or for general explanations of a policy process, that is your Medicare Administrative Contractor customer service. It's not a policy department type question. However, if you are asking for a reconsideration of either a local coverage determination or a local coverage article, LCD or LCA, that is specifically done through the policy department, and you must follow the policy rules and guidelines as set forth by CMS. I'll show those to you in a moment. Also, for new LCDs and LCA requests, So please don't contact our policy department if you're just looking for those general explanations. That is customer service. The very specific question that was asked of me that I did want to use is, how do I get an LCD looked at again? I'm going to assume you mean, how do you get us to reconsider whatever we have for coverage criteria? If I'm wrong, put it in chat. But you're going to come to the WPS website. It's our LCD. Go to the topic center, go to policies. Within policies, you will see the LCD and NCD reconsideration process. Now, NCD will be explained, though we don't do those. Right here on the top. If you want to look through the full list, you can do that, and you can use by any of these. I don't want to do that. I'm just going to use my quick link. By using the quick link, I find out everything I need to know. First, local or blah, blah. Local max. Okay. Here's the LCD reconsideration process. Here's what you have to know. Here's the process itself. Here's the components that have to be within it. The language, what are we looking for, and then how to submit. So then what to expect. On the very last part, it talks about NCD reconsideration process, because we don't do that. And it does refer you back to the CMS website where you will find the information for that. So while this is great to go out and kind of hunt around, if you know where it is in the WPS website, you don't have to do that. You can simply come here. You can either select this link. I'm going to go ahead and open it in a new tab and just open it up, and it'll explain the whole process for an NCD request. Okay. The other part of that was asked was to submit a new. And so you can go through the LCD reconsideration process. You can look at the draft or proposed. If we scroll down, we can actually put new within our search feature. Okay, it's local coverage determination. I want to do a new local coverage determination request. And this will walk you through all the steps and how to do that. So versus me just explaining it, I thought this might be a good resource. You guys can take a look at that if you need that. I did have a very specific question about how do I get a hold of WPS MR, medical review. I'm not sure exactly what you're trying to get a hold of them for. So in general, they do not take inquiries. They do handle specific targeted probe and educate inquiries, in which case you'll be giving a nurse educator, and that nurse, well, I shouldn't say educator, she's an educator / analyst. Her job is to work with you on the targeted probe and educate process. Now, I'm not going to get into the whole process. I'm going to leave that, and I'm going to ask you guys to attend the upcoming future education for new to Medicare medical review. It will go through that process a lot more. I do want to let you know that for most inquiries, when it comes to medical review and information, you do need to go through our customer service lines. They are able to handle almost all of those general inquiries. Again, we don't say all of them, because if it's a general inquiry related to your targeted probe and educate, you will be assigned a nurse, and that is the person that you will work with. I do want have a nurse online. She's our nurse educator. Her name is Mary Sue Gardner. And I just want to reach out to Mary Sue and give her a chance if she has anything to add. She may or may not say anything at this point, but Mary Sue, do you have anything to add?
Hi, Tom. I do not have anything to add. Thank you for covering that information, though.
Okay, perfect. Again, Mary Sue, who you just heard, she's going to do some education a lot more specific, and I want you guys to be aware of that. So here's one of the big questions we got, and I built this slide to address about 10 questions, maybe in total. Maybe it wasn't quite 10, but who do you contact when it's a claims related question? And again, Medicare administrative contractor customer service, if it's not claim status. If it's claim status, don't ask for that. That is a self-service tool item. Now, if it's why is my claim denied, or hey, you're saying this got bundled into something else and I don't understand, there's nothing else there, that's a customer service question. A self-service tool can't tell you where it's going into. Hey, it's saying that there's a Part A stay out there, but I can't find one. I don't understand what you're trying to get me to do with that. That's a customer service question. You know it's denied. You know it went into a Part A stay, but it's what you can't find. So ask the question very carefully, please, when you call customer service. Also remember, they do handle all the general inquiry questions. Does your system like this modifier with this procedure code? Those types of things. If it is related to a Medicare Advantage plan or a Part C plan, again, anything claims related and related to a Medicare Advantage plan must go on to that MA plan. This would include the appeals process. If you don't feel like they're following the Medicare rules, please make sure that you contact the regional office with control over them. You do or may need to contact a primary payer to get information from them so that you can get the system updated. Remember, you can always submit a claim with primary payer saying, hey, they denied it, it's not a part of their benefits, or it's denied because it's outside their time frame for eligibility. That's okay on an individual claim basis, but the primary payer does have to issue you the letter so that you can update the BCRC. So that's why we say that that may be a claims related function. We did have a few questions about Veterans Administration, and I want to make it clear, we are not Veterans Administration. We do not answer questions on how you need to bill them. What we can tell you is if the Veterans Administration pays on a service or a line item, we will not. We are not secondary. This is not a secondary payer situation. The federal law prohibits two federal entities from paying on it. The next question that we got related to that is, well, TRICARE pays on it. What TRICARE pays after Medicare is the portion that would be the patient responsibility. They do not pay the same portion that Medicare pays. That would be a double payment. Because the VA does not leave a portion of payment when they authorize the service, they're not making a payment, or they are making a payment, therefore it's all paid. So hopefully that kind of summarizes that. We do have different classes on the Veterans Administration and how that works with Medicare. Someone asked about, in particular, what we call bundling, and I did just briefly mention it, but it's when another provider is actually responsible for a payment, such as a skilled nursing facility or a hospital, and it depends on the services. So yes, you could have to contact a different provider. They may need it billed in a certain manner. Sometimes it is the patient to get certain things done, a little bit less common, but just so that you are aware that it could potentially be there. Provider outreach and education, this is us. Provider outreach and education is only related to outreach and education of the masses. So you could ask us to come and speak for you at an event for you. Now, when I say for you, I'm not talking about necessarily, hey, you have to come to me in person and I want to sit in an auditorium with you. You could ask us to speak via teleconference or webinar, whatever you want to do there. That's one time you would request us. We do take pre-submitted question and post-submitted questions for 7 days following an event. Now, why is that important? I received comments that you had been at an education event and that you sent it in to us. And my question to you is, how old was that event? Was it 30 days ago? Well, that event is considered closed by us after 7 days. Therefore, we won't take those questions. So it just depends. We also take inquiries about our advisory group, which is the Provider Outreach and Education Advisory Group, or POEG. That's really the only times you're going to get to contact us. Again, our website contains our contact list, so please take advantage of that. If you're not familiar with that, it's right here, and it's Contact Us. Use the drop-down, select what you need. So again, WPS, GHA, and contacts. Which brings us to some questions again. Is there a direct number for credentialing? We've already talked about this, and no, there is no direct number for them. You will only be given a number should you be contacted by a representative working on your application. The next question, rejects and how to find out what is needed. So if you know it's rejected and you're not sure what's happening or why that rejection is needed, then contact customer service, but please be very, very specific with them. I understand this claim has this issue. I don't know how to fix it. There's no guidance on how to fix it. I don't understand the rejection. Those types of things are customer service related, not the claim status. The most common question, or the reason that people get frustrated and are turned away related to that, is that they're actually asking for claim status. With that said, Aline, do we have any questions?
There are no additional questions in chat at this time.
All right, well, I'm going to keep rolling. One of the things you heard me talk about is some different resources and things that are important that you need to look at. Now, the reason that I thought the resources are important is because if I'm going to tell you you have to use a self-service versus contacting customer service, shouldn't I at least explain a couple of those to you so that you do have some different options? So our biggest resource is actually on our website. This just, again, explains that secure self-service requirement. Sorry, this is that section that Aline gave you. I had her give it to you earlier as I was talking about it, but I just wanted you guys to have it again, just in case you need it. So again, our biggest resource is on our website. This is the Secure Net Access Portal, or SNAP. Many of you may be aware of this. It is a resource that does require a unique login. And so you do have to register. You do have to have an NPI administrator, the first couple of people to log in, who, if there has never been a login for that National Provider Identifier or NPI, will be required to do extra verification and become an administrator. There are features that go with that. On the other hand, there is something that you can simply do to check eligibility. It's an eligibility only user, and they get access to the Part A and B eligibility, the Medicare Beneficiary Identifier, those types of things. Very simple things. Now we say simple, and then I say, hey, hold on. Eligibility is a lot more than just, are they eligible for Part A and B? Such as, do they have a primary payer, would be listed under eligibility. Are they in a home health stay? Are they in a hospice stay? All of that is under eligibility. Then we also have claim status, which you can get, and claim status includes things like the duplicate remittance advice. So there's a variety of different features under each one, and you can take a look at those if you're interested. I'm going to show you just a quick resource on this, and then we'll go on. If you've never looked at the portal user manual, okay, that's what you want to do. So the portal, which is this secure section up here, and will remain on our website on any page you're on until you log in and you enter a username and password. You can register, you can look up a variety of different things. Here's the portal user manual. This will go through section by section each thing you need, including steps for registering, steps for becoming an NPI administrator, the responsibilities, all of those different items are here. I want to focus just briefly on down here under eligibility. So you can see patient transactions eligibility. The question that was asked is, they keep being told to look up different areas under eligibility, but they're not sure what we're talking about. So they come in, and if you go in, you access, you enter your username and password, you'll be given this little look. The second item on there is eligibility. Now this bar will be available. You do have to enter certain pieces of information. These are required by CMS, and no, we cannot override them. Then you're going to get your eligibility and your supplemental insurance. Eligibility is what we're talking about. And you can see it's far more than just Part A and B eligibility. Yes, you will get Part A and B eligibility, but you also get deductible, end-stage renal disease, home health, etc. So take a look at the portal user manual if you have additional questions on that. Another self-service tool that you can get a lot of information from is the interactive voice response. The question was, is it broken? We can't get eligibility on it, and the answer is no, it's not broken. CMS is doing a test. The test is that eligibility is no longer available on the interactive voice response. They're evaluating whether or not they want to bring it back after a certain period of time. No, we don't know when that will be. So this is what is available, which is why I put it in here. So hopefully that helps make sense. Another person said that they bill on they bill on an 837P, so I had to read through the question, and they bill on a 1500 claim form, but they've heard of this direct data entry. How do they get access to it? Well, first, you won't be able to get access to it. Direct data entry requires access to the Fiscal Intermediary Standard System, or FIS. These claims are billed on a UB04 or 837I, which means that there are facility-based claims for inpatient or outpatient services. Doesn't matter, but they're being billed on a UB04 or an 837I. The question indicated you did not qualify for that, therefore no, you're not available for that. So hopefully that helps you a little bit about what DDE is and how what you're gonna find inside there. We do have classes on this available as well, so check out the encores on those if you want. I did walk you through this, but here's the MA plan directory as promised, a little bit of slide on that just as a reminder. These are just some CMS websites that I found helpful. So I thought, hey, let's put them in there. You guys take a look at whatever one you want. This is the direct link to the MA plan directory. I talked about the local coverage determination, the national coverage determination. Here's the page that we showed on the CMS website, just giving you a direct link instead of having to go to ours. Here's the database that shows local coverage and national coverage determinations and all information related to it. The internet-only manuals are our day-to-day operating manuals, kind of our instructional manuals, your instructional manuals. So I thought, hey, why not? And then a little bit about CMS medical review pages, just to kind of wrap up all of those different resources. I also found these to be some helpful pages. Again, just related to the landing page, the training center, the user manual, the IVR. We've talked about all those, but I wanted you to have links to the different resources as well. Which brings us to the end. And I want to throw it out there first. Aline, did we have any questions in the chat?
No, there are no additional questions.
Okay, so I have 2 questions and then we'll move on. So first question, who do I contact for billing scenario questions? In most cases, this will be WPS customer service. You also may want to watch different Encore videos and things like that. I'm not sure what type of billing scenario questions you have, so I can't give you a better answer than that. How do you get in touch with a Medicare Transplant Services representative? A Medicare Transplant Service representative is through 1-800-MEDICARE and is typically available to the patient. So if you need to get in touch with that particular person, you do need to contact the patient. They need to contact 1-800-MEDICARE. You can be on the line with them to help them through that. All right, let's finish up here for the day. So first, I'm going to give you the opportunity to get an email directly after. Unless you dialed in, then you won't get it because I don't have your email. We'll talk about that in just a moment. Here's what this email will contain. It's going to contain a survey link. Please, again, we're going to talk more about that in just a few moments, but please take the survey. It's also going to contain a certificate of achievement that has contact hours. We do not give you CEUs. We give you a certificate of achievement. You turn those into your governing body for contact hours. So keep this email. That is what you'll have to turn in, and you need to work with your governing body to figure out how they need this. If you do have follow-up questions that arise in the next 7 days, because remember, after that, we'll consider the event closed, please email us. The email is there on the slide, and it's wps.gha.education@wpsic.com. In the subject line, include who are the players. Again, I want these within the next 7 days, please. All right. On to the survey. Hey, I've given you a piece of advice about this, but let's talk about it real briefly. Again, take the survey, tell me the good, the bad, the ugly, whatever you want to tell me. Now, I say the good, what did I do well? The bad, what did I do poorly? What does WPS do poorly? You get to grade us on that as well. And the ugly is, did you like my PowerPoint? Did you like the resources that I showed you, or did I miss something? Give me all of that information. Please don't forget that this is your opportunity to tell us what other types of education you would like. You can take the survey right now by using the link in the chat. Take it right now. You can also take the survey by waiting for that email follow-up to come out, or one last opportunity, and that's going to be to take it using the pop-up box that's going to appear. Yes, I know it's going to have an orange triangle with a warning. It says external site. It's going to look exactly like this lower picture, but please note it has CMS, MAC, Fed, RAMP. Note the first part of that. That is our survey. Okay. Also, during the Encore presentation, I want so much feedback that I'm even going to give you a chance to take a survey by using the picture that looks like this. And if you select that during the Encore presentation, you get the chance to take the survey again. So lots of opportunities to take this survey. Please do so if you can. Oops. With that said, I would like to thank everybody for attending. We do understand that your time is valuable, and we do appreciate you joining us today. Please remember to take the survey, but also remember to include topics. One of the big things we do not have within that survey is the topics that you want. They do not have to be related to who to contact. Also, make sure that you're signing up for the additional new to Medicare programming that we have coming up, and that's the one that we talked about with medical review. It's coming up a little bit later this month. So on behalf of myself, Aline, all of Provider Outreach and Education, hey, thanks for participating. We look forward to your survey comments and hope that you'll join us again in the future. You may now disconnect.